So for my portion of the project, we'll be starting with the event that we chose. So the event that we chose, we researched Dr. Thomas Andrew, the famous medical examiner who is now retired and worked in New Hampshire. He started his career as a pediatrician, and he talked about a case in which he suggested an autopsy for an unresponsive child who had no physical signs of trauma to the naked eye, and so they suggested an autopsy. This quote by the medical examiner basically identifies the fictional realm on TV about medical examiners and autopsies, and shines light on the fact that there needs to be prior knowledge used and a bunch of other resources in order to fully determine the cause of death of a patient. So autopsy details. There was a 911 call about an unresponsive child. First responders could not identify any physical signs of trauma, in which Dr. Andrews came and suggested an autopsy for the child. They conducted an autopsy. They conducted x-rays in order to identify any red flags, any major red flags, such as any fractured ribs, any healed or partially healed bones or fractures like in arms or legs. Then they found that everything was normal. They decided to go in with the Y-shaped cut in the abdomen to look for any trauma or physical signs of trauma to the organs, such as the lungs, the liver, the heart. Everything was normal. Then they finally decided to do the examination of the skull, in which they found a small, distinctly patterned lesion to the skull, and Dr. Thomas Andrew made a point in which saying that any injuries below the hat line are usually caused by an accident, and any injuries above the hat line may be signs of intentional trauma or intentional abuse. And so he used that information in order to look further into the autopsy. And how did the autopsy or medical examiner solve the crime? Basically, the breakthrough happened when he found a large number of iron-filled cells in the child's lungs. Usually this was a sign of repetitive asphyxia. So then he reported that in his report, and investigators interviewed the primary caretaker of the child and found that the caretaker would occasionally squeeze the child when the child became agitated or would cry too much in order to get the child to stop. And with this information, investigators were able to indict the primary caretaker, and Dr. Thomas Andrew stated that the cause of death was asphyxiation by compression to the chest, and it led the primary caretaker to be indicted and led to a plea deal. We have a video which is on YouTube. The link is in our presentation, and then this is our works cited page.